I want to walk through all the steps of an intubation with you guys. Also, I got this video from George ORRT on YouTube. Intubating someone is where we put an endotracheal tube down a patient's airway and connect it to a ventilator in order to assist the patient in breathing. So this provider just gave that patient some sleepy medicine. I'm not sure what, but it's a medication to help this patient go to sleep. This appears to be in an OR setting, so slightly different than intubating at the bedside, but pretty similar. He's following up and giving something else. And as you can see, this person here is providing the patient with probably 100% oxygen. The medications we give for intubation allow the patient to fall asleep very quickly. And as a nurse in the ICU, my job is to push medications and keep an eye on the patient's vital signs. It's a little difficult to see, but you will see the patient's respiratory rate here go to 0, and then their end tidal will also disappear as well. In the OR, your anesthesiologist is doing all of these steps, but in the ICU, typically the provider is intubating and then we are doing all the other little things. The provider here is now going to insert an OPA in order to keep that patient's airway open and is going to provide them with some oxygen. You'll see here in a second that he's going to squeeze his little bag in order to ventilate the patient, and you'll be able to see the patient's chest rise and fall. We don't always do this step in the ICU. Usually we go straight from giving the medications to intubating, but here he is allowing the patient to fall a little bit more asleep. This provider is actually going to use a gyroscope, which has a camera on the end of it in order to see the patient's vocal cords and airway, but you still will see some providers using like a Mac blade or a Miller blade. He's tilting this patient's chin up in order to get a better view of the airway, and you'll notice that this person is pushing pressure right here on the patient's trachea in order to get a better position to insert the ET tube. Here's the gyroscope picture. You can see the patient's vocal cords. You want to go right in there. Easier said than done. This looks like a patient that's probably relatively healthy, that's getting some sort of procedure. A lot of times there's a lot of yucky gooeys in there, and so suction definitely should be set up and ready. Once the ET tube is placed, they are pulling out the stylet. The stylet is keeping the firmness of the tube when it's being placed so it doesn't bend all over the place. This person's hooking up a manometer to check the pressure of the pilot balloon. To confirm placement, we usually look at the patient's end tidal CO2, which you'll be able to see on the monitor here in a second. We also look for chest rise and fall. And in the ICU, we like to get a chest x-ray. And from here, we're just going to make sure the patient's vitals stay stable. We're going to keep them nice and cozy and secure that patient's ET tube. And that's the steps of an intubation. Let me know if you have any questions.